All right, welcome to our Wednesday lives. I'm just gonna get everything situated and then we'll get going here. Hope everyone's had a wonderful week. All right. Okay. All right. Hope everyone's doing well. My name is Dr. Roger Tsai. I'm a board certified plastic surgeon in Los Angeles and Miami. I'm just gonna get there we go. Let's do that. There we go. Perfect. We're on TikTok, Instagram, and YouTube. And so yeah, this is a Q&A session for you guys to know and learn about anything you guys want to know about plastic surgery. Okay. Either my life, my journey, how I got here, anything you guys want to know about breast surgery, face surgery, body surgery. This is a forum where, basically it's been very productive and very robust, where patients can come and ask and, basically get some information about anything that they're interested in, whatever procedure they're interested in, or any questions that they have before they go and see an actual plastic surgeon. But I am located in Los Angeles, mainly in Miami. And so for those of you who want to come out and see me, I'm here. Which country? USA. USA. I'm just going to get started here on Instagram. Let me see how I get on Instagram here. This one. Maybe this one. Here we go. Nope. Live. Here we go. All right. There we go. Sorry, I'm just getting the Instagram ready to go. There's a new update. It's a little funky here. There we go. All right, there we go. All right, Alyssa, what are your thoughts on soft wave? It's worth trying before going all in on a neck lift. So soft wave is supposed to be one of the better skin tightening devices. I think there's Morpheus, soft wave, and then Zerf, which is a new one that just came out. I think those three are probably the top as far as what is best for skin tightening. I would say it depends on how bad the neck is. Okay, if it's mild, sure, you can start that. If it's more moderate to significant, you're probably not going to see much as far as results go. So I would say you can start off with that. Absolutely, there's no harm in starting off with that. You definitely may see some benefit. Again, it might be minor benefits, nothing significant. But if you want to start off with that, it's fine. But if it's moderate to significant, you're going to need that neck lift anyways. You might as well save your money on that soft wave. So I guess that's my 2 cents on that. All right, can you do otoplasty twice and having some? You can do, are you talking about otoplasty like ear pinning? If you're talking about ear pinning, yes, you can do that twice if you need to, not a problem. And having some scar tissue, yes, you can go through the scar tissue. It's going to be a little bit more difficult anytime you do a revision. The reason it's more difficult is because of the scar tissue. So yes, you still can do it, absolutely, no worries. Where did you go for med school residency? I did medical school at Drexel University in Philadelphia, and then residency, University of Texas, in Texas. So yeah, great. All right, we got Instagram on. Okay, so before, as we get more people on here, I do want to say, please click on the link tree in my profiles. I'm on TikTok, Instagram, YouTube right now. We got 3 cameras kind of showing here. So click on the link tree in my profile. We do have a lot of great information on there, a lot of links to everything. More specifically, there's a link to schedule a consult into my actual schedule. So if you guys want to do a virtual consult or see me in person, you can book directly into my schedule. There's also a link to my before and after Instagram page, so please take a look at that. We try to post multiple times a week. I don't know of any other people who has as many before and afters as me, without tooting my own horn, but everybody on that before and after page is new, so there's no duplicates on there, okay? All patients are brand new, or different, I mean, so it's not like I have one person that posts 4 times. No, they're all different patients. And I have a YouTube page that has all my consultation videos. So those of you who want to see what a consult looks like, you can kind of look through those videos. I got a TikTok that's a little bit more of a funnier, lighthearted content. Instagram that has some educational content there as well. And so I would urge you guys to please click on that link tree and kind of follow me and support me on all those sites. Hello, Romella. How are you? Hope you're doing well. It's my first time. Great. Well, welcome. Let's see. Are you in Philly? I'm not in Philly. I did medical school there, but I'm in Los Angeles right now. Venezuela. All right, Javier. Thanks for joining from there. I hope you're doing well. I tried calling you yesterday. I don't know if you got my message, but just wanted to check on you. I'll try calling you later and see how you're doing. Can you get a very slight nose job, and is the procedure different to a big one? Yes, you can. You can do like a tip plasty, and which is just a tip without kind of the bridge. You can do a little bit on the bridge if you'd like. There's different ways of doing it. Yes, you can do a slight one. That's something we can talk about more during the consultation process. I'm amazing and happy. Great. Good to hear, Amela. I'll try giving you a call later and seeing how you're doing. Okay. Okay, yes. So yes, long story short, you can do a little bit of one. Heavily medicated and sleep, doc. No worries. You're good. You're good. Take your time. All good. I'm just glad you're doing well. All right. Do you do under eye acid peel? No, I don't do that. I do fillers for the under eyes, and I do under eye blepharoplasty or skin tightening. Sounds good. We'll catch you soon. Yes, I do under eyes surgery, fillers, maybe, but I don't do acid peels. No, I don't do acid peels for that. You might want to go see a dermatologist more for that particular issue. Okay, great. Where are you located? I'm in Los Angeles, and I do spend a week out in Miami once a month. Usually the last week of every month, other than December, but both here and there, so both places. What is a mommy makeover? So a mommy makeover basically involves some type of breast and body procedure to restore the body back to its more pre-pregnancy state, okay? It could be as simple as a breast aug and a little lipo, or as complex as a breast aug, breast lift, lipo, tummy tuck, and a BBL. So it's more of a generalized term for just restoring the body after pregnancy to a somewhat pre-pregnancy state. But what exactly is done within a mommy makeover does vary from each patient to patient as far as the details go. I'm a guy. What about direct neck lift? Yeah, you can. The funny thing is, the last person I talked to just 10 minutes ago, I was a little bit late for this live, but the last person I was talking to actually was talking about a direct neck lift as well. So your traditional neck lift goes around the ear here. You lift the skin up, you kind of tighten everything from there. But there's a direct neck lift where you put a scar directly here, and that can really tighten the skin here. So it tends to tighten the neck better because you're directly incising the skin, as you mentioned, versus trying to lift it from behind the ear. And so as far as the final result goes, as far as tightening of the skin, it might be better, but you have to live with a scar that runs down the center. As a man, if you grow a beard or have like that 5 o'clock shadow and you kind of grow it there and you're never going to see the scar, I think you're never going to see it. I think it's fine. But you're trading one thing for another, if that makes sense, okay? Do you ever perform brow pexies? Yeah, actually, I do. Actually, the last person I was talking to was actually talking about the kind of doing a brow lift as well. So yes, I can to a certain degree, depending on what you mean by a brow pexy. If it's like a brow lift, yes, absolutely. Do you take insurance? No, I don't take insurance. What about dark skin due to insulin resistance? That you're going to need to talk to more of a dermatologist about. I'm more of a surgeon. I don't really do a lot of like dermatological issues. Hi, Kemla. Thanks for joining. Do you recommend fat transfer to under eyes? I think it's amazing, yes. The last person, again, I keep mentioning the last person I talked to is doing a lot of different things to his face, but the last person I was talking to, his main concern was trying to put fat grafting actually to the temples and to the under eyes. He has lots of volume in the temple area, a little bit older. And so we talked about fat transfer to the temples, the under eyes, and the cheeks. So yes, I think it's a great procedure. It's a bit more involved than fillers, but yes, I think it's a great procedure. What do you with a stiff neck? That is more of an orthopedic question. It might be something with the spine. What technology do you use for floppy arms? Well, there's not really a technology for it. There's a procedure for it. It's called an arm lift where we take out the loose skin, but there's not really a technology for that. What can I do for my hollow under eyes? I'm afraid of fillers. Fat grafting, just like somebody over here on Instagram was talking about. You can do fat grafting for the under eyes. It's your own fat, it's your own tissues. There's a lot of stem cells in there, so there's a lot of regeneration of the surrounding tissues. The skin, the collagen thickens, and fine lines and wrinkles kind of go away. So yeah, you can also do fat grafting there. Is it true you have to have another breast augmentation after a couple of years? That's not true. I mean, I would say as long as there's no issues or problems, leave them in forever. I mean, you can probably keep them in forever if everything is well and is no issues. Lifting the brow from upper bleph incision is what I was asking. You cannot lift the upper eyelid. You can't lift the brow from something down here, right? It doesn't work. You can lift the eyelids from either the upper eyelids or the brow. You are correct. You can lift it from here, but there's no way you can lift the brow from an incision here. You have to make an incision above the brow. Okay, so if you want to make an incision here to lift the brow, sure, but it's physically impossible to lift something making an incision below it, if that makes sense. You have to remove some skin in order to lift it. Miss Me My. Do I know you? Sorry if I'm not recognizing who you are. I need a full body lift. What 2 surgeries could you do first? My stomach is very large. I would say I always like to address patients with, who I'm sure you had massive weight loss. That's why you have a lot of loose skin everywhere. I like to address what bothers the patients the most. Most patients seem to be bothered by their breasts and their tummy. So more likely than not, again, sounds like your tummy was what bothers you. We could do your stomach and your breast at the same time. We could do a tummy tuck, breast lift, maybe a breast dog if you need to, and maybe some liposuction in one sitting if you want to do that first. I have to get my breast exam every 3 years. You don't have to get your breast exam. I mean, you should get your breast exams, with your regular, doctor. And that's kind of, I think, a standard thing. But if you want to get your breast examined every 3 years with your doctor, that's fine as well. You don't have to, but, it's probably not a bad idea to do. Would you recommend PRP for under eye hollowness? PRFM. PRP is the liquid portion. PRFM is the more solid portion of the PRP, so I would do the PRFM portion, but yeah, I guess you could. Mm-hmm. What can you do if you had liposuction on your back and you can see so fat is coming? I'm not sure what you mean by that, Camilla. Like, if you still have fat there, you can do another round of liposuction, I guess, if that's what you're asking. Well, you just don't want me to shadow you. Well, I don't really have shadowing opportunities. We're in private practice and all of our patients are very private and we like to keep it that way. And so I would, unfortunately, we don't have that. You probably would have to go to more of a teaching facility for that. Where are you located? I'm in Los Angeles, and I'm in Los Angeles, basically. I know. Hi, Mary. Good to hear from you again. I know you mentioned going above the muscle would be a good option for me, but do I have enough breast tissue where it won't show rippling and look natural? For you, I think so, yes. You don't have, the wall makes sense. You don't have where you have no breast tissue. In that situation, I might be more reluctant. You actually have some breast tissue, so for you I would be more okay doing it. That is one of the concerns, right? Like, you tend to have more rippling if it's above the muscle, but because of the newer Motiva implants that don't tend to ripple, and I haven't really seen, knock on wood, the Motivas ripple quite yet, I think that would be a good option for you. But again, that is kind of the risk that we're talking about, right? The reason this isn't quite so popular is because we don't know, could there be rippling in a year? Could there be rippling, down the road? That I can't answer. That I couldn't answer for you. So that's kind of a little bit of the playing around or the experimenting, as I kind of mentioned, that we would be doing for you. But I think with what I see from you and kind of what we've talked about, I still think that's going to be more advantageous for you. Okay. Any way to get gynecomastia removal covered by surgery? You mean insurance? Hard for me to say because I don't take insurance. How much is full body lift, the breast lift, augmentation, thigh lift? It really depends on how much work needs to be done. It's hard for me to give you a quote over here because you're asking for a lot of different things and you probably have massive weight loss as well. So what type of lift do we need to do? Because there's 3 different types of lift, right? What kind of thigh lift do we have to do? There's 2 different types of thigh lifts, right? So a lot of these procedures are customized for patients, and a lot of the quote generally has to do with the time that it involves in the surgery. So something like this is hard to give a general estimate over. Garden Vixen, if you want to click on the link tree in my profile and schedule a consult with me, we can have a consult. We're doing free consults to the end of the year, okay? And virtual consults, that is. We're doing free virtual consults. So if you want to chat, we can do that for you real quick and get you a quote and then take it from there. Lost a lot of weight from stress and my chest literally goes down. What can I get to get a lift perky? So Volume and skin are separate issues. We treat them separately. So an augmentation will give you volume, but it's not going to give you any lift. A breast lift will give you a lift, but no volume. So most times you're going to need both a lift and an augmentation to give you that volume and that lift. Why do some doctors use drains and some don't? It depends on the procedure. I generally try to avoid drains if I can, because it's a nidus for infection, because there's something going from inside to out. Plus, it's patients don't like it. It's kind of annoying for the patient. So I try to avoid it if I don't need to. It just depends on the situation, I guess. It's hard for me to say. Tummy tucks, I always use drains because most of the time I do lipo. There's a lot of fluid that collects in there, and there's a lot of open space in there. And if you don't do it, you sometimes can get seromo. So I kind of always generally use drains for that. I kind of almost always use drains for anything that I do as far as capsulectomy goes, where we're removing capsules from the breast. Other than that, I generally don't use drains. I lost a lot of weight this year. Why do I lost a lot? I can't answer that for you. I don't know if it's stress or are you on medication. I don't know. That's going to be hard for me. Only you know why you're losing weight there, Camilla. I lost a lot of weight from, answer that. As I've gotten older, my mouth looks like I'm frowning. What can be done to help with that? So the reason it looks like it's frowning is because the tissues are falling, right? Like as the facial tissue falls, this is going to get heavier, the mouth is going to get heavier, and it's going to get turned down. So you're going to do some kind of skin tightening procedure. Facelift, neck lifts for the surgical aspect, maybe some threading or lasers to help kind of tighten the skin a little bit from the non-surgical standpoint. So those are kind of the options, I would say. What are the long-term effects of facial balancing? Well, I mean,